Namaskar, chief guest of this conference, Commissioner Bimal Kumar Dubey, President Dr. Sadhana Gupta, Dr. Sharda Jain, Dr. Mayank Kumar Singh, Dr. Ragini Agrawal, Professor Hema J. Subane, Dr. D. Nath, Dr. S.N. Kanchan, distinguished guests, all delegates, ladies and gentlemen. It is truly an honor and privilege to stand before you today at the third annual conference of the North India Gynaecology Forum, hosted by the Uttar Pradesh chapter in collaboration with the Jhansi Obstetrics and Gynaecology Society and the Department of Obstetrics and Gynaecology, Maharani Lakshmibai Medical College, Jhansi. Organizing a conference serves as a dynamic platform to knowledge exchange, professional development, and collaborative innovations in the rapidly evolving field of the obstetrics and gynecology. Staying updated with the latest research, technology, and clinical practices is not just beneficial, but it is essential. Conferences brings together experts, young professionals, and academicians to discuss emerging challenges, share success stories, and inspire new ideas. They also foster interdisciplinary partnership and networking opportunity, which are critical for holistic patient care and effective policy advocacy. Most importantly, such gatherings reinforce our shared commitment to continuous learning, improved health outcomes, and community well-being. I extend my heartfelt congratulations to the organizing team for putting together this significant academic gathering that brings goals of the most critical and timely issues in reproductive and community health, the high-risk pregnancy and youth health. The theme of this conference is very relevant. Despite the advancement in maternal care, high-risk pregnancies continue to challenge clinicians, policymakers, and healthcare systems. The burden of high-risk pregnancy still remains high, especially in resource-limiting settings. As doctors, our mission must be twofold: prevention through the early identification and health education, and preparedness through a strengthened referral system and clinical acumen. Reducing maternal mortality and morbidity is not just a medical objective, it is a social commitment. We must remember that most of our patients do not speak the language of medicine. They speak the language of concern, tradition, fear, and hope. As healthcare professionals, we must meet them where they are and explaining danger signs in simple, relatable terms, using local language, analogies, and understand that creating a space where they feel heard and respected can make all the differences. I know when I was in the medical student, and VRD, I did MBBS from VRD Medical College, Gorakhpur. I was in final year posting, and I was just in the OPD, just like the medical student. And at that time, one lady came to the doctor, and other side, the senior doctor was also sitting. So that lady told the doctor, कि डॉक्टर साहब मेरी छत गिर गई है. इसके बाद डॉक्टर साहब ने कहा कि आपकी छत गिर गई है तो मैं क्या करूं, आप बनवा लीजिए. अब जो सीनियर डॉक्टर थे वो समझ गए कि क्या कहना चाहती है, क्योंकि उस लेडी को प्रोलैप्स यूट्रस था. Also, you must know the communication and the local language. They communicate in that. That is important for that. So the lady told, the doctor told, this is a prolapse uterus, and accordingly the intervention will be done. So the communication is very important. The youth health is also critical to focus. This area is often neglected in mainstream discourse. Adolescents are the backbone of our demographic dividend. However, they are vulnerable to the misinformation, mental health issues, substance abuse, poor menstrual hygiene, and lack of sexual and reproductive health education. Empowering youth with accurate knowledge, supporting health systems can transform not just their individual lives but entire community. This calls for the shift from the reactive care to the preventive and promotive health care models. The forums like NIGF have a pivotal role to play by bridging knowledge gaps, enabling collaborations and shaping policy through research and advocacy. I am delighted to see so many passionate professionals from across the country or region gathered here to exchange the insights, present innovations, and inspire each other. Dear young doctors, budding specialists, and future leaders in the women's health, the theme of this conference is high-risk pregnancy is not just a medical condition, it is a call for the action. Every day, countless women in our country walk into the pregnancy not knowing the silent dangers that may lie ahead, whether it's hypertension, anemia, diabetes, or complications due to the young or advanced maternal age, or many of these risks can be prevented, identified, and managed if only someone cares enough, listens closely, and acts early. As young professionals, you are on the front line in the OPD, rural health centers, labor rooms, and wards. Your training, your alertness, and above all, your compassion can make the difference between the life and death, between the healthy mother, child due and devastating outcome. High-risk pregnancy does not always announce itself, but you must learn to detect at its whisper before it screams. Use every resource, antenatal checkup, checklist, community health workers, mobile technology, and telemedicine. And don't forget to educate, because when you empower a woman with the right knowledge, you have already halved the risk. Let your practice be guided not by the books but by the empathy, and your decisions be quick and your judgment be deep. You are not just the next generation of the doctors, you are the first line defense against the maternal mortality. Now, it is a call for the holistic approach. So let this conference must be more than scientific meet. Let it be a call for the action to widen reach, strengthen, and resolve, and work collectively towards a future where every pregnancy is safe and every young person has the right to health, dignity, and opportunity. Before I conclude, I once again congratulate the organizers for selecting such a vital theme and curating a rich academic program. I look forward to the deliberations and hope that each of us carries home not just knowledge, but a renewed sense of responsibility. Thank you once again for this honor. Jai Hind.
I request Sadhana ma'am to felicitate our special guest, Saudan Singh sir.